experience at Wits. Okay, sorry. So obviously we want you to have the best experience possible while you are at Wits, and that is one of our key objectives, both as a university as well as a faculty, to try and provide you with the best postgraduate experience possible. So that's really the purpose of our orientation. Now, I would like to share my screen with you because we have got a presentation sort of just to speak through. I'm sure you guys are tired of all these talks, but at least hopefully, you know, just looking at some slides will make it a little bit easier for you. And just in the interests of time, we've obviously started late. I think we'll go quite quickly through the presentation. Our faculty librarian, Mr. Devin Peters, will join us at 10 o'clock. So I think we'll move across the presentation and then we'll stop at 10 o'clock and then continue afterwards and then hand over back to Paul. And I'm assuming Wantanda is on as well. So he's our Faculty of Health Sciences rep. I think, yeah, so we joined today by our faculty registrar, Mrs. Sandra Ben, Professor Eleanor Liebhaber, who's our, you know, responsible for a whole bunch of research things that happen in the office, and as well as the biostatistician. Then Anushka, I'm sure some of you may have interacted with Anushka Ajit already, and then myself. So I think in the interests of time, it'll just be myself and Eleanor who will just talk through some of our slides, and then we will all be available to take some questions afterwards and hopefully have a great discussion. All right, so now why is this not letting me move? Okay, so we do have an outline of the presentations. Obviously, I want to give you an introduction to the faculty. Some of you may already have been in the faculty and are aware of the lay of the land, but I think it's a good overview, and I think I'll run through some of the facts that you guys are not necessarily familiar with. We'll then look at our postgraduate office, what the people do there, and just to give you a little bit of insight into the postgraduate booklet that is specifically for the Faculty of Health Sciences that we have, that's available online. Our most recent one isn't online yet, but it will be soon. Then we'll talk in a little bit more detail about what we do in the research office, and then just talk about some of the expectations we have of our students. So, sorry, I'm not sure if you can, let me just move. I've just got everyone's names and pictures on the edge, so I don't know if everyone can see the full slide. All right, so what is the purpose of our postgraduate orientation? Now, I think the key thing, people obviously, you know, haven't started the research in any significant way yet. So the idea is that you start building and developing your Wits identity and your sense of belonging within the faculty's research community. And I'm going to show you why we are actually such a great research community. And I hope you leave here with that sense of how wonderful the faculty is, and you know, it's a great opportunity to be part of it. So we also want you to gain an understanding of, and obviously I can't spell of, sorry, can you just mute everyone, Paul? So you can gain an understanding of who will be able to support you, both academically, socially, as well as an individual on your journey through this postgraduate experience. Sorry, Paul, can you just mute people?
Yeah.
Oh, come on. Paul?
Yes.
Can you hear me again?
Yes, we can
Okay,
hear you.
sorry, Paul, thanks. I think please
Yes,
can everybody just keep themselves muted? And yeah, that was the youngest postgraduate student we've ever had, I think. Right, so just to start again, I think we want you to start developing your WITS identity and also start understanding how you fit into the faculty and start getting your sense of belonging within our research community. We also want you to gain an understanding of who can support you, both academically, socially, as well as an individual. And obviously I can't spell of, sorry, apologies for that. Now we have several goals within our faculty research office. So just to highlight that actually we are the only faculty of the 5 faculties in the university that actually have a position for an assistant dean that's responsible both for research and innovation as well as postgraduate support. If you look at all the other faculties, that the position is separate. And I think we're more fortunate because, you know, it's a lot more work, but it gives us a better oversight of everything. And I mean, I obviously have the ability to link everything more comprehensively versus having 2 separate people doing the job. We also the only faculty that really has our own established research office, which then interacts with the postgraduate office as well in such a close way. And you'll hear a little bit more about that as we go along. So part of what we want coming out of today as well is an understanding of the intellectual engagement and scholarly inquiry that we would want you to gain as you move through your degrees. We need you to be aware of your professional development and how you would ultimately become a leader in your field. We want to instill community values in you, look at inclusivity and see what your expectations and standards, the expectations and the standards are both from our side as well as your side. And obviously, you know, look at your health and well-being as students and as individuals. So our faculty is made up of 7 schools that are involved in both teaching and training undergraduate students as well as postgraduates. And the postgraduates are at all levels, starting from honors and postgraduate diplomas, all the way up to a PhD, as well as the MEd and MDent registrar training. I thought if we had more time, I would have maybe liked to have seen a show of hand of who's on from all the different degrees, but maybe we can have that in the discussion later. And based on that, I could have modified the talk just to emphasize maybe certain degrees more, but I think we'll leave it at that for now. We'll be a bit more generic. So the faculty is obviously involved in research and innovation, clinical service, as you're full aware, as well as community engagement. So our 7 schools are anatomical sciences, and I'm going to go through all of the names of the heads of schools. So for those of you who don't know, I think it's important you find out the name of your head of school, as well as your head of department, outside of knowing who your supervisor is. If they happen to be one and the same person, that's great. But, you know, in some instances, in many instances, that's not the case. Sorry, wait. So anatomical sciences, we have Professor Madi Ihunwa, who's the head of school. Clinical medicine is Professor Dania Ballot. Oral health sciences is actually an acting head at the moment. It's Joy and Professor Judy Bruce that are sort of co-managing oral health sciences at the moment. Pathology is Professor Johnny Mahlangu. Physiology is Professor Billy Daniels. Public health is Professor Tobias Chua. and therapeutic sciences is Professor Helen Miezwa. So familiarize yourself with these names, because these are individuals, and then, as I said, HODs, because these are the individuals you might need to get signatures and letters for while you're here throughout your degree. So in terms of our research excellence, we have very well established research areas, and it's the most in the university. We currently have 28 university recognized research units, research entities, 4 of which are actually institutes, and those are big research centers. We have 6 South African Medical Research Council research units, 8 individuals who are SACHI chairs, so they have funding from the National Research Foundation for very focused areas of research, and that's supported over many, many years. We have 2 centers of excellence, and then we have several NRF, the National Research Foundation, rated scientists, and you only get rated by the NRF once you start having both a national and an international reputation. And in our faculty, we have 10 what we call A-rated scientists. And if you're an A-rated scientist, it means you're a world-recognized expert in your field. So it speaks to what we'll talk about later, building research excellence, but you are surrounded by many, many people who are actually world-recognized experts, whether they have an A rating or not. So I think it's important to immerse yourself in the faculty and really take advantage of who you're surrounded by. So this is something that we're really proud of, although it does change over time. In terms of our global rankings, and I'm sure you've probably heard a bit about this, our faculty is definitely in the top 200. We have dropped slightly in the last few years. We've actually dropped from being in the top 50 to 75. And the last couple of years, we've dropped down. So we've got the Times Higher Education rankings. And you can see in the clinical and health disciplines, we are, between 125 and 150. In terms of the Shanghai rankings, in public health, we're sitting in the top 150, and in clinical medicine in the top 200. As I said, I think we've dropped, and there's multiple reasons for that. If people are interested, we can have a discussion around that. I do think in the last couple of years with COVID, perhaps the university hasn't focused on actually submitting all of our documents and that to the relevant people. But regardless of that, we take a step back. WITS is always ranked either first or second in South Africa, obviously, versus UCT. And pretty much again, depending on the rankings, we have ranked first globally. Within Africa. So just to put it into context, there are like thousands and thousands of universities, and the faculty that you are registered in is literally in the top 200 of the world's universities. And it speaks to our research excellence. It speaks to the commitment of the people that are here. It speaks to the commitment of all the postgraduate students that we've had previously, that we currently have. And it speaks to actually the expectations that we have of you as well. So, we expect you to be great. We will provide you with everything you need to become great and to become great researchers, going forward and into the future. And we hope that, we continue along those lines. Now, again, what's really unique about our faculty, we are the largest faculty of health sciences in South Africa. And geographically, so I've put this map out just to share with you our faculty. So here centrally we have our Faculty of Health Sciences, but you can see obviously we linked closely to Charlotte, Barra Hospital, but then we have academic platforms out in Klerksdorp, in Mpumalanga, you know, far out. So we're not just sitting in one small little area. We are across many, several provinces, and yeah, so and across very many different hospitals. Now, it's one of our strengths that we have so many platforms that we can access, because the number of patients and I guess the disease profile that we are seeing gives us the great opportunity to be able to do brilliant research. It is one of the downfalls when we are looking at a postgraduate experience and trying to build a postgraduate culture, because, you know, and again, I don't know of the people that are on the Zoom call today, you know, some of you might be based in Mpumalanga, somebody might be based at Barra, somebody here, somebody out at Sterkfontein. So, you know, it's quite difficult to build an identity around that when people are spread all over the place. Overlaid with that, I've just highlighted some of our, you know, university recognized research entities. These are all obviously abbreviations, and, you know, we can go into all of these, into these names if people are interested. But in the yellow, we've got all of our clinical sites, and you can see there's a clinical site out in KZN as well. We have a whole lot of clinical trial sites nationally, which, you know, then if I put on this map, it's just actually far too many. And then we have several basic translational science research units that are actually based in the faculty building behind me. So you can see the scope of our faculty and the distribution of all of our researchers as well as students. Now, if we look at the faculty at a glance, we have over 6,800 registered undergraduate and postgraduate students. We'll look at that in a little bit more detail later. Collectively, and I think this number is a bit outdated, it's probably higher, we have at least 10,000 hospital beds that our clinicians and our academics and our researchers obviously treat patients across all of the hospitals. If we look at our staff complement, WITS employs about 600 people in this faculty, of which about 50% or so are academics and researchers, and the rest are professional and administrative staff. But then we have the staff that are joint staff, and they are employed by either the Department of Health or the National Health Laboratory Service, and they are the clinicians, consultants that are, you know, throughout our different hospitals, or that are the leaders in the different research units. And I'm just going to point out VIDA, which is based at Chris Hani Baragwanath Hospital, and the VIDA is one of our big research entities, which is actually headed by our dean, Professor Shabir Mahdi. You know, and they've been instrumental in conducting several pivotal clinical trials which have had an impact globally. And I think, and I'm sure because we've all lived through it, the most recent, I guess, was around COVID. So VIDA, WRHI, you know, CHRU, some of those are the units that were involved intimately, and PHRU that were involved intimately with some of the COVID vaccine research that was happening in terms of the vaccine clinical trials, as well as therapeutic trials. We then have a very unique situation in our faculty. We established the WITS Health Consortium a few decades ago, a couple of decades ago, and it's actually a grant management company. It's a university-owned company, and and some of you may in fact have bursaries through the WITS Health Consortium if you're affiliated with any of these big research entities. So WITS Health employs over 4,000 staff. So collectively, you know, if we look at everybody, we have well over 8,000 staff, whether it's clinicians, researchers, administrators, all of that affiliated with the faculty. So we're really huge. And that's the backdrop against which you guys can learn as much as possible and really immerse yourself in research and really benefit from it. I'm sure you've heard this a gazillion times, but obviously WITS is really research intensive, and this faculty is particularly research intensive. In fact, we are the faculty that produces the highest research outputs in the university. And last year alone, our researchers actually brought in well over 3 billion Rand in research funding and funding for implementation sciences. We have several key areas of research excellence. And again, if you look at the map and we talk about the kinds of patients that as researchers, and I know it sounds terrible in a way to say that, but the patients that we have access to because of the large footprint of our faculty is huge. And over time, it's allowed us to have to develop certain areas of research excellence. And that ranges from infectious diseases, public health, non-communicable diseases, expertise in genomics and functional genomics, as well as doing translational studies. And whatever we do is, you know, if we look at it in the global context, we are working towards meeting the targets of the SDGs, the Sustainable Development Goals, which are a global target. And SDG 3 is really what's focused on good health and well-being. But by creating a population and a country that has better health and well-being, we obviously have a huge impact on several others of the SDGs, things like no poverty. Healthy people are able to go and work and be more productive, which alleviates poverty. You know, people can go to school, have better education, you know, et cetera, et cetera. So we don't have to go into that now, but that's really the ultimate goal. And I truly hope that every single one of you that is here because you really want to make a difference in health and improve the health and the health service, and, you know, make a real big difference in our country, on the continent, and obviously globally. So we have a really huge footprint of collaborators globally. And again, you know, this is in fact a moving number, because we come up, you know, we collaborate with new people every day. But amongst our researchers, there are, you know, there's thousands of individual collaborations. And you can see on the map, you know, we had put out the number of universities that we're collaborating with across the globe. So what you'll find is, for example, let's look at MIT or Oxford or Cambridge. What you'll find is that there'll be multiple people collaborating with different departments within each of those universities. And, you know, if any of you in discussions with your supervisors would like to be put in touch with international people, you just need to let us know, because we have a real, you know, we have a running database of this. So global collaborations, well, national and international collaborations provide many, many opportunities, and it really broadens your horizons, and we do promote that. We have great opportunities for providing joint degrees, and there are some joint degrees in place already with international universities. And then obviously it provides you with the opportunity for travel, exchange, to do technology transfer, go overseas for more training, all of that sort of stuff. So it's quite a dynamic environment. In terms of the research and the infrastructure we provide you with, and it comes back to what I heard several people talk about in yesterday morning session. Both the Dean of Students and the DBC talked about how being a postgraduate student is isolating, because you tend to focus in your environment, in your lab or your sort of clinical research area. But keep in mind, and I think this is part of the induction and sort of giving you the broader picture, is that in our faculty, we have the resources and infrastructure literally to undertake any kind of research. And we're talking from basic sciences. We have state-of-the-art laboratories, pretty much with really up-to-date methodologies and all of that sort of stuff. We do have an animal unit to be able to do preclinical testing and a host of other tests, implementation sciences, social, behavioral sciences, clinical studies in the different academic platforms, and all the way up to very well-established clinical trials that do international human trials from phase 1 all the way up to phase 3. And we have an arm looking at translational research. So, if you need something for your research and it's not within your supervisor's scope, or it's not available in your department, reach out and see if it's available within the faculty or within the university. And often you'll find that all of these things really are available. Now, let's look at quickly metrics and how we look at how good the faculty is. So remember, I said to you, we are the faculty that produces the highest publications, in the highest number of publications and publication units in the university. Now, the reason I've sort of put this up, and you can see over time, we've really been growing, and we've been growing considerably. The units that are allocated to the publications we produce are linked to the Department of Higher Education and Training. Based on that, the university gets government subsidy. So it is important to have publications and to have publication outputs, because it brings money into the university. But just as importantly, it's linked to our global rankings. So, if it's recorded properly, we then have, and people cite the research, and it's also in high impact journals, our profile is raised, we have a better international standing, etc., etc. So this is very closely linked. If you look at, in the next slide, I did a breakdown of, so we haven't finalized our 2022 publications, and this is why I'm showing the data for 2021. So if you look at the breakdown of where we've published, and the ultimate goal of all research is really to do research that is novel and publishable. Now, again, that depends on the degree that you're doing, but keep in mind, your career growth as a researcher is linked on your publications and that sort of stuff. So keep this in mind. But if we look at the distribution of our publications by the journal's impact factor, what you'll see is we're getting, and we've been shifting to the left over time, which is a good thing. So close to about 30% of our publications are in journals with an impact factor of 5 and above. The majority are sort of in the middle, or over 50% are in journals that have an impact factor of 1 to 5. And then, there's the category that are below 1. All publications are valuable. That's not to say, we are pushing publications in higher impact journals, but the volume is important, especially when people are training and establishing themselves. When we look at impact factors, we're talking about the quality of the research and the impact of the research. So the more to the left we move over time as a faculty, the higher the quality research we are publishing, and obviously the global impact and how many people will read that paper and how many people will cite it and actually use those findings becomes broader and broader. Now, if you look at the over 15, it's not a bad percentage, and it's really comparable with a lot of other universities globally as well. Here you're looking at publications in the New England Journal of Medicine, Nature, Science, Lancet, and those, if any of you get into any of those publications, I mean, that's really, getting to the peak of your research careers. So I wish that for all of you, but it's a lot of hard work. Okay, then just turning to our postgraduate numbers, which obviously is very relevant for you. We can see that we have been increasing slowly, and we've sort of reached a plateau really, but we're sitting and in this year we've actually dropped our numbers to around expecting 3,000 postgraduates to be registered, and that's obviously across all the years of study. And we as a faculty, close to 45% of our student body is actually a postgraduate body. So really there's a lot of you, and you're a critical component of the success of this faculty. So over time, you can see we've increased the number of people that are enrolled, and I've put next to that the actual number of people that graduates over time relative to the number of people that are currently enrolled. So you can see our number of people graduating over time has also increased. And the percentage, sorry, now I'm moving this thing around. I don't know if you guys can see that. The percentage of people that are enrolled versus graduating has also increased over time, which means we've managed to improve on our throughput rates. So people are coming in, you are registering today, and you tend to be graduating more on time. And as a postgraduate student, I think that is important. We've all been postgraduate students, and, you want to do your research, you want to complete your degrees, but, at some point you also start getting itchy to go out there and start working as well. So, it's encouraging that our throughput rates are increasing, and we want to be, so when you look at this 3,000 enrolled number, that encompasses master honors all the way up to registrars who are here for at least 5 years. So, it's a mishmash. We obviously have the data separated out, but this global number, we want it to be between 25 and 30%. It means the majority of you are graduating in time. Just in terms, and just very quickly, I think just in terms of time, we have a breakdown of the postgrad students graduating from each of the 7 schools. You can see clinical medicine is the largest contributor, and obviously that makes sense. There's a huge number of doctors who are specializing in various disciplines, and they have large numbers. It's then followed by the School of Therapeutic Sciences, the School of Pathology. So you can see again, I think there are general increases in the number of PhDs graduating across each of the schools. And, you know, some of them are more sort of plateaued, others are increasing. It's just out of interest sake. So then just putting all of that together and sort of seeing what the faculty is about comes back to the question of, you're here to do a postgraduate degree. What do we want you to know by the time you leave WITS with the degree that you have chosen? So obviously the expectations that we have of you as postgraduate students will increase with the degree. So what we expect from you as a PhD graduate is going to be very different from an honors student. So Paul, sorry, just in terms of time, I'm not sure if Devin is on and if he wants to just talk, because he's not available for very long.
Prof, you can go ahead and finish. I'll hold on.
Okay, let me just get through the next couple of slides, then we'll hand over to you and then we'll come back. Okay.
Thanks.
So, all right, so in terms of what kind of postgraduate students do we want to be exiting WITS that we can be proud of and that you can be proud of, that you have a degree from this faculty, from this university. So we look at things like your intellectual engagement and your scholarly inquiry. Obviously, we want you to start becoming an independent researcher. We want you to demand of yourself, and demand is a strong term, but we want you're surrounded by research excellence. We want you to finish here, demand excellence in yourself, and then promote excellence wherever you go. You know, whether you're in the university still or, you know, elsewhere in South Africa or the continent or the world. We want you to value academic integrity in your work, and academic integrity is really, really, really important. And then I guess, you know, while you're at WITS and then going out there is learn how to effectively engage and work with a host of academics and clinicians and research supervisors, as well as the collaborators. In terms of your professional development and leadership, we need you to understand the importance of ongoing professional development. You've chosen a research career. Your brain does not switch off. It's a 24/7 thing. If you think you're ever going to have evenings off and weekends off, you don't. If you're a passionate researcher, it consumes you every single moment of your life. We need you to take ownership of your career and your career path and growth, and obviously take the initiative to get all the skills that you need, and obviously obtain all the skills that we can give you, as much as we can give you, that will ultimately, once you leave here, you can just continue working towards becoming an international leader in your field. And there are many, many people that have graduated from here. Some are still here and they are internationally recognized leaders. Some have gone out there and have made names for themselves. In terms of your community values, inclusivity, you know, we want you to look at the whole range of student groups, organizations, social and cultural opportunities that we offer on campus and throughout the university. We want you to practice mutual respect and maintain the community standards. We want you to understand the university rules and responsibilities of a postgraduate student. Those are available on the university's website, but that's something you take with you wherever you go. You always have to orientate yourself with whatever environment you're in and understand the rules and responsibilities, understand the nuances, and it comes down to understanding these universal rules, and some of them are not written, but hopefully you will learn as many of those through your time here. so there's these universal rules and responsibilities that are related to academic and research environments. So in terms of your health and well-being, it's really important that people have a good postgraduate experience. They are happy, they feel supported, you know, and if they face any challenges, whether it's personal or within their research, that they feel supported. Looking at the bigger picture, we want you to have understand that you have a collective responsibility to protect the well-being of everybody that you're working with, whether it's staff or students, the patients you may be working with, whatever the case is. We need you to acknowledge the importance of self-care for yourself, for others, and then care for others, and importantly, know the WITS resources that support health and well-being. And I'm sure you heard a bit more about that yesterday. I think on that note, let me stop. Devin, I'm not sure if you have slides or if you just want to talk. I can just stop sharing.
Yes, Prof, I have slides as well.
Okay, I've stopped sharing, so I'll close my video. Sorry, I muted and I was saying over to you.
Okay, no worries. I'm not sure if it's sharing as yet.
You can just see a picture of library or books on stands.
Okay. Something come through?
Yes.
Okay, I wanted. Okay, if you joined yesterday's session, you would have probably actually seen me on stage. My name is Devin Peter, and I'm the Health Sciences Librarian. I'm just going to talk to you about the library, and WSL, which we actually refer to it as being the WITS Health Sciences Library, is an amazing information place. You would have heard yesterday, WITS has 11 libraries, of which the WITS Health Sciences Library is located on the 4th level of the Health Sciences building on the Parktown campus. In other words, we're actually at the main medical school building itself in the foyer on your right-hand side when you actually enter the building. So this is the entrance to the building itself, to the library itself from the foyer, so you know where to actually get in. With regard to the WITS Health Sciences Library, we try to aspire to provide outstanding resources and services to advance education, research, and clinical excellence. We also assist in supporting research activities that is you, the student, especially in your postgraduate studies, and these need to be registered with students and researchers. We provide an environment that is conducive to learning and for research engagement with network computers and Wi-Fi throughout the facility. And the library maintains a print collection of print books and journals, as well as current electronic journal subscriptions and ebooks. We provide access and support to electronic research databases, which includes common resources like Access Medicine, Clinical Key, Dynamed, Medline, Ultimate, UpToDate, and Web of Science. And numerous sessions are on offer to improve the effectiveness of managing and using these information resources throughout the year by group request or by individual sessions. And the individual sessions can either be physical, one-on-one, or on Teams or the Zoom option if you're not actually on campus physically. Our library hours are from Monday to Thursday from 9 a.m. until 10 p.m. On a Friday from 9 till 6. On a Saturday from 8:30 till 5, and on a Sunday from 2 p.m. to 8 p.m. at night. Your student card needs to be carried with you at all times, as this is your passport or access to all WITS facilities. So despite the entrance actually having a wave reader that allows you through in facilities like computer labs, as well as in the library itself. There's card access with that. And eventually, hopefully that will change in time. The entrance to the library, when you actually walk into the library, once you've tapped in your card for entry, on your left-hand side is a notice board that has the core databases with QR codes. It gives you access to these resources that the library has a subscription to. And note that these are paywalled resources, so without access to them via the library website in itself or the LibGuides that I'm going to talk to you about, you won't have access to these resources. On your right-hand side, there are a lot of blurbs about the resources that you can actually use during your course of study at WITS, and as long as the subscription is continued as well. The special collections are books that were actually donated to the library by Raymond Dart, who started the library around 1923. Professor Asher Dubb, who was a long-standing library chairperson, who bequeathed his books to us. And obviously the other famous person from the faculty is Professor Philip Valentine Tobias, whose collections are part of the special collections. And these books date back many years. The book collection within the library, we try and ensure that we at least have a print copy of a book, given the fact that not everyone can actually access electronic material at the moment because of data bandwidth and because of the areas that they live in. So there are books available for actually borrowing, and these go out for different time periods. The general collection is from 1800 until 2007, when we jumped onto the bandwagon of electronic resources and made that available to you by a point-and-click interface. The classrooms that are available for you to use, the Cyber Resource Center and the Cyber Classrooms, as well as walk-in centers downstairs on the 3rd level of medical school, will give you access to the university resources and all your computing needs by logging in using your registered staff and student details. And these computers are actually linked onto the WITS network. And you also have access to logging in your device using the Wi-Fi with your WITS credentials. There's a discussion room if you need to actually sit in a group and talk through, because obviously in most places of the library, it is more for kind of self-study, and people expect you not to actually make a big noise. There's power docking stations and as I mentioned, Wi-Fi access throughout the WITS Health Sciences Library, and you actually just bring in your plug and plug into the power units that are available. And obviously for additional downloads and other IT access that you have at WITS, there's a booklet that is actually online, available at www.wits.ac.za/access, that tells you about your computing and downloading of resources from the WITS network in itself. We have photocopying and printing facilities that are available to allow you to scan any documents, photocopy, as well as print any of the articles or information that you actually require. But obviously you need to put money onto your student card in order for this to be done. And there's the loading machine in the foyer of medical school, which we call a DVT machine or the Kurubucks machine, that allows you to actually make these prints. And there's minimal cost. For black and white, it's about 40 cents a page. And for color prints, it's really nominal. It's 70 cents a page in itself. Remote access can be used to, as long as your device basically has your WITS email account on it, where you could actually email your document to the black and white machine by emailing it to bw.xerox@wits.ac.za. And in the instance of color printing, it will be color.xerox@wits.ac.za. These can be spooled to these machines from anywhere, as I mentioned, as long as you have your WITS email account and you're using that. And it can be collected at any photocopying or printing machine at the medical school or any part of the campus itself within 48 hours. There's a self-checkout unit for taking out print books that you could actually use yourself if you don't require any assistance in actually doing so. The reception and information desk has two sections for inquiries as well as an information section where the staff will basically assist you with whatever query you have. Now, IT assistance is also available within medical school, but the main help desk is situated in the Solomon Mashlangu house on the second floor of that building itself. And you can actually contact them or make an appointment to see them, which is the better option at 011-717-1717. At medical school, there are two technicians that are available, but they service the entire medical school as well as the peripheral hospital sites where there is VIT staff and students on those sites. So it can be difficult for you to actually find them in the office themselves, but they can be contacted on 011-717-2495 or 2785. You can also send through an email query. And obviously, if you're having problems with your VITS email, when you actually email them using your private email, you would need to ensure that you give them your student details so that they are aware that you are a VIT student and it's just not a hoax email coming through. You can email them at itstudenthelp@vits.ac.za, and the physical office location at medical school in the building on the third level or third floor, as we refer it to, is in room 3N15, and that's just before the entrance to the unit for undergrad medical education, and where you see the red arrow, that's where the office is. And you can try your luck. In some cases, you're lucky to actually find technicians in there that can actually assist you. The access to the library resources can be done directly from the General University Library page of www.vits.ac.za. And from the General University page itself, there is a link directly to the library. You've got access to this on campus as well as remotely, but obviously for remote access, you need to create a library PIN. In order for you to actually do the library PIN itself, you would need to actually go into your My Library account, put in your details, and which is obviously your student number, firstly your surname, your student number, and you would create a library PIN of 4 or more numbers, and it needs to be numerical and not alphanumerical. Once you've actually created your record, it opens up your record. And if you were a previous VIT student in your undergraduate years, it gives you access to your reading history for all the print material that you had taken out. And it also gives you an option to actually modify the PIN that you created in the event that you feel that it has been compromised, because this PIN needs to be used by you only. Remember, using these machines, using the computers at WITS to log into your record, you need to ensure, because it's a public facility, that you log out from your record. In the event, since you are returning to WITS, that you had actually previously created a library PIN, because remember, your student number becomes your number for life. Within WITS itself and on the library system, it still remains until it's actually totally archived. In the event that you have already created the library PIN, you would need to reset that by clicking onto the Forget Your PIN option, where an email link is sent to you to your WITS email, where you actually need to click onto the link to reset the PIN itself. We've unpacked all the resources that are available for the WITS Health Sciences Library on items called LibGuides, which are basically study guides. And the LibGuides from this faculty itself are all unpacked, so it makes it easier for you to actually access the resources themselves. There are 178 LibGuides, of which WSL has about 49 of these LibGuides in itself. So you'd need to move down to the WSL LibGuides by moving down the page and coming into the LibGuides that begin with the prefix of WHSL, standing for WITS Health Sciences Library, and having a look at the subject guides. The two most important LibGuides that you have access to is the WSL e-resources in healthcare LibGuide and the WSL e-books collection in itself. These LibGuides basically have a standard format that gives you information about the library itself, where you basically have a block that tells you about the library links, databases, ebooks, alphabetical listing of these ebooks, the ebooks according to medical subject headings, which are terms that are used within medicine in itself. So example, if you're looking for anatomy books, you would actually click onto the anatomy link. If you're looking for psychiatry books, you click on psychiatry. The ebooks, recommended prescribed textbooks, are mainly books that are used by the undergraduates, but in some cases, if you've forgotten aspects of undergraduate education, you have access to these books as well. The e-journal finder option allows you to find a journal that is available by subscription from the library in itself, so you have access to that option. The ebooks collection standard also, where it gives you a link to the ebooks collection that is provided to you from the various publishers, as well as information about printing and photocopying and your device action, etc. You also have a link to the ebooks that are alphabetical, as in the previous slide of the Whistle e-resources in healthcare. So you are able to actually click onto any of those titles to access the books themselves. There's a LibGuide with regard to research support that tells you about research support within the university, about developing a research question, research methodology, all in general, in addition to whatever is available for you from the postgraduate office themselves as well. There's a LibGuide with regard to copyright compliance, basically with regard to South African copyright law. Obviously, WITS takes plagiarism very, very seriously. And obviously, you'd need to be aware of this as a higher education graduate and a student as well. So the LibGuide basically will give you additional information. And this was mentioned in yesterday's talk as well, with regard to the aspects that we have available to you as the general library in itself. There's a LibGuide for researcher e-visibility, and obviously where you basically create your own ORCID ID, which is giving you more better research standings. And in some cases, if you are publishing, some of the publishers require an ORCID ID, but there's a LibGuide that basically will give you more information about this, as well as creating a Google Scholar profile, showcasing yourself, the Scopus Author ID, as well as the Web of Science Publon IDs that are available. Information resources that are available, they are print books, so don't forget there are print books as well as ebooks. And obviously the print books are on our open shelves for you to actually take out for a period between 1 and 2 weeks. There's print journals. Oh, not everything is available electronically, so note that if you are doing historical research and there are references to articles prior to 2007, you would need to actually check on our print catalog to see the availability of these on our shelves. Ebooks are all unpacked and available from the e-journal portal that is linked up to the general university library setting. Ebooks that are linked up all on these LibGuides that we have available to you. Clinical Key, which is the Elsevier product, StatRef, Access Medicine, Access Surgery, Access Pharmacy, Access Physiotherapy, Up to Date, EBSCOhost, as well as ProQuest, which are multidisciplinary resources that have additional links to additional databases that you would search for your literature. The LibGuides in themselves, I'm just pinpointing yet again that all these tabs basically has additional links for you that you would actually go in. And obviously at this stage, everything is alphabetical. So you'd basically click onto the book title that you want alphabetically to get down. And when you actually hover your cursor over the block that you're actually wanting, you'd need to ensure that you move the page slightly to have a look at the remainder of the alphabets after you. The current newsstand is available to you as WIT students from the database resource called Press Reader. This is available either using a computer or downloading the app, but more information is basically available on the information sheet that I've actually sent through, and Dr. Ajit has actually placed it on to the chat for you to download and have access to these resources. We have a Twitter feed, and the Twitter feed basically gives you links to current literature that's published in the core medical journals like NEJM, Lancet, NEJM, Lancet, BMJ, if there's anything that comes through, and any links to full text books that have been updated on the Clinical Key platform as well. The services on offer, we provide database services where we have access to various health databases, and besides the health databases, in total there's about 241 databases within WITS itself that you have access to, and they are multidisciplinary access to these as a registered student. We have journals which offer access to a wide variety of full articles that are indexed in the databases that you're going to search. Our print content for the journals are from 1800 right up until 2007, and thereafter everything is actually available electronically and unpacked for your access. There's the interlending document delivery system that gives us access to national and international resources that are not available at any WITS libraries. We provide information literacy training or instruction, as I mentioned, to individual as well as group training on the use of electronic resources and how these can be accessed remotely. We've got a consultative service on research strategy design for retrieval of information for literature reviews, either physically or virtually. And there's also an Ask the Librarian chat service link where if you have a burning question and you need to actually get clarity on that you'd actually click on from the LibGuide or from any of the library pages to question a librarian and get your question answered. Libraries access. As a student, you have access to all the University of Witwatersrand's print and e-collections. There's enough study spaces. There's about 425 study spaces within the library itself. There's discussion rooms, network computer facilities, as well as Wi-Fi access and power docking stations. And there's also the My Library app that can be downloaded from Google Store itself, as well as from the iTunes platform that will allow you to use your mobile device to access the catalog in picking up what is available at the Whistle Library itself, as well as other WITS libraries in all. I'll gladly take any questions. There's two questions in the chat. If Paul, can you actually just monitor for me since I'm sharing?
Okay. Yes, there's a question. There's a question from Memory. I'm not sure if Memory can speak to your question.
Oh, thank you, Paul. And thank you very much for the informative outline of the library. My question is simple. I just wanted to ask if there are any special arrangements. I'm based in Cape Town for if you collect print books to go beyond and extend beyond the 2 weeks mentioned in returning the books.
Yeah, for print books, if you actually are coming up for a block release, we can actually extend it for the period itself. But unfortunately, we're unable to send it directly to you. If you need to, we could actually arrange, depending if it is an item that you want, with the university library closest to you, that we could actually send it via the interlending service to them.
Thank you very much.
Okay. Any other questions?
I don't see any from the chat. I don't know if someone can raise their hand if they want to ask a question.
Okay, if there's no other questions, I've sent through 2 info sheets with regard to how to access the health sciences resources. And these can be accessible anywhere in the world, as long as you have a library PIN and you are a current registered student with the university. It gives you a breakdown of how to set up a library PIN, step-by-step fashion, access to the resources, about searching PubMed, about changing your Google Scholar profile or setting in order to actually pick up any of WITS resources itself, access to Clinical Key, which is an aggregator that has journal articles as well as books available from Elsevier in itself, access to the ORCID ID, the option within PubMed where you need to actually register with NCBI in order to have your results emailed to yourself. So without registration, you won't be able to use that facility. And all of you have probably used PubMed at some stage just before you even came into actually do a higher degree. You would actually see the options of saving, emailing, as well as sending to a citation manager itself. Just remember, a trained librarian is a powerful search engine. That's the only difference, that we basically have a heart. So my email address is actually posted, so you can email me if there are any questions, or use the library chat service for any other queries that you have if you don't want to email. Thank you very much. I'll stop sharing. Over to you, Paul.
Thank you for that important information. Prof. Maria, should we come back to you, or should we move over to the next item? I'm not sure if she's still there, but then the next on the item is Dr. Okay.
Yeah, so Paul, yeah, I've unmuted. So Paul, sorry. So we have changed the program slightly, just also to accommodate time. So let me just speak through around the postgraduate office. I think quickly before, let me just stop sharing. If Mrs. Sandra Ben, who's our faculty registrar, if she's still online, and if she wants to just show her face so people know who she is. Sandra, are you there?
I am. Can you see me?
Yes. So everybody, this is the most important person in your life for the next year. Then come your supervisors.
Good morning, everyone.
So Mrs. Ben is our faculty registrar, and she oversees the postgraduate office and all the administration and that associated with it. So just in the interests of time, I will speak to the postgraduate office. Sandra has to be involved in another meeting, but she'll be online to take any further questions if people need to ask her. So if I can't answer it, she'll do that. All right, so let's now move on to the overall processes that come together to get you your degree. So there's a host of administrative stuff either you or your supervisors would have to do, and the postgraduate office and the postgraduate committee oversee that. You then do the research wherever you are based. You do the research that falls under the scope of both your supervisor as well as the health sciences research office under my portfolio as well. And then we have the overall postgraduate experience. So the postgrad experience is a combo of all the admin, how your research is going, how your interaction with people are, and obviously your friends and all the social things across campus. So if we look at the administrative process during your degree, you are all here, so you've obviously applied to be admitted, you were accepted for your degree, and you've registered already. We give you a specified amount of time to work on your research proposal with your supervisors. You then have to submit a protocol. If you're a master's student, it gets assessed at school level. If you're a PhD candidate, it gets assessed at faculty level. And honors students, each school has various processes around that. Your protocol has to be assessed. You have to be present with your supervisors at these assessments. Once it's approved, then you can move forward. Critical, and it's part of the whole process, is whether or not you need to apply for human research ethics. So if any of your research requires human, human research or animal research, you have to apply for research ethics clearance, unless your supervisor already has ethics for your project. But so that needs to be in place. Once you have all that in place and you have a final research ethics clearance, human research ethics clearance, you can then start your research. So you do the research over the period of time. You would start publishing if it's the kind of work that you're doing, and ultimately you get to the stage where you've met all your study objectives and you finalize your write-up, and you then submit it for examination. We've introduced from this year PhD symposia. So if you're a PhD candidate, you will definitely be doing that in a few years' time, just before graduation, and it's a nice way of showcasing your research to the entire faculty. And then you proceed with graduation. So along this whole process, there are very specific forms and very specific signatures you need to get. So the forms are all available in our postgraduate booklet as well as online. And if we get a chance, I was planning on showing you later on our website, but if we get a chance with time, I will do that. If not, we'll just give you the website address and you can search it yourself. So there's the forms, and then the signatures you would need, depending on the document, it's your own, as the supervisors, your HOD and or the head of school, so that you would need to do. So always keep in mind, if you need signatures, don't leave it to the last minute, because your head of school or your supervisor might not be available. So try and be as efficient as possible around that. There's some administration that happens from the supervisor's side as well. And I guess just keeping an eye on that. So when you submit for examination, your supervisor has to have nominated examiners before the postgraduate office will accept your work for examination. They have to do that at least 6 weeks before you submit. And I know it seems like a long way away, but what you have to do is make sure that your supervisor knows when you intend to submit by, so that they can put all of that stuff in place. So our timelines from registration to completion vary, obviously, based on the degree that you get. Now, this amount of time is based on, again, the Department of Higher Education and Training times that they give us, and this is what they subsidize for degrees. So honors degree, and I guess a PG dip, depending on what people are doing, it generally takes 1 year. You have to complete within the year. A master's by coursework and research and a master's by dissertation is 2 years. And here I'm talking full-time. A PhD should be 3 years, and then your MEd, some disciplines are either 4 up to 5 years, and your MDents, depending again on the discipline, could be between 3 and 4 years. Now, as I said to you, we have the stats, we separate everything out according to the different disciplines. PhDs seldom finish in 3 years. You're looking at 4 to 5 years to completion. Same thing for the masters. We would allow up to 3 years. So on these timeframes, you add an extra year, I guess, for part-time for the degrees where that's relevant. But this is the time frame that the university expects people to complete their degrees by. We are a bit flexible, giving people an additional 1 or 2 years or so, but keep in mind that you have to plan your work carefully, and you have to meet these milestones. Now, well, the graduate completion milestones. Now, along your career path through this degree, there are several milestones that you have to meet. And I haven't put it on because, you know, there's different milestones depending on the degree you have. But, you know, it's about the proposal submission, ethics applications, etc., annual reports, all of that. So turning now exclusively to the postgraduate office, Mrs. Sandra Ben is responsible for both the undergrad and the postgraduate office. So she manages all of the students in this faculty, but and obviously oversees postgrads. So her offices are situated in the Philip Tobias building. We're at the bottom of the hill. She's on the second floor. The whole of the second floor is dedicated. The one side's undergraduates, the other side is postgraduates. So you will, and I'll show you on the next page, you'll need to familiarize yourself with who deals with your school, your department, and those are the people that you interact with. We have that information, we can give that to you. So the postgrad office is really the central support and liaison office for postgraduate students. They have all these processes in place to ensure that there's efficient customer service for all the students, prospective students, staff, and any other stakeholders that are associated with the university. They implement the university's Senate standing orders as well as the faculty standing orders. So my office and Sandra's office, we have to work within the confines of the rules and regulations of the university. So some of the schools or departments might have some specific rules that they expect you to do. Again, you know, for the purposes of these couple of hours that we have with you, we can't go into details, but you know, if in doubt, make sure that whatever you're doing is within the confines of the Senate standing orders, Senate and faculty standing orders. So the postgraduate office liaises with the Office of the Assistant Dean and the Postgraduate Committee. Now, the Postgraduate Committee is the governance body that exercises the quality control over the processes regarding the administration of your studies in this faculty. So please rest assured that there's no one single person that makes the decisions on your future. There is a committee, there is an office, and we make decisions collectively. So the overview of the postgrad office staff, as we said, Sandra Ben is the faculty registrar. There is a receptionist. You can ask to direct you to the appropriate people. There are 2 senior faculty officers, several faculty officers, and a couple of admin assistants. So different people have different functions. So for example, Anna Mironga, and I'm sure several of you will have interacted with her, she organizes registrations. Zahira Khan is responsible for the nominations of examiners. So Anna, you will meet at the very beginning of your degree and every year subsequently when you register. Zahira is the person that's important at the end of your degree as you're submitting for examination. Then the different senior faculty officers and faculty officers are responsible for different departments and different functions within the different departments and different schools. There is a document on all the functions. We won't go into that now, you can access. In terms of the resources that you will have as postgraduate students, there is a postgraduate website for our faculty, and you can also access the postgraduate website through the Health Sciences Research Office. And I can show you that later. So we put together every year a postgraduate information booklet, and then there's also a style guide for how you're supposed to write up whether you're doing a research report, a dissertation, or a thesis. And this is currently being upgraded because we have introduced a few changes in how people can submit for examination. So if you're an MEd student, for example, now when you finish your research component, if you publish it, it does not need to go out for further examination. That was something we passed through our faculty grad studies committee. It then went to the Senate Graduate Studies Committee, and we changed both the Senate and the faculty standing orders around that. So, you know, when we change certain rules, it has to go through a process. So we're just upgrading that. So there is a booklet dedicated to the registrars that are through the School of Clinical Medicine, but it's obviously relevant information for MEds across the faculty. And an MDent booklet is also in development. Here's the website for the research office, but I can click on that a little bit later to show you. So there's various sections in our postgraduate booklet, other than all the forms, because all the forms you need are in there. You can see them, and then they're downloadable from our site. But in the one section, it's obvious we run through all the programs, but then we walk you through, admissions registrations, how to write your proposals, the formats of your thesis, the exam process, graduation process. In section 2, there's some information around funding, and that would be to support bursaries. There is other funding, and there is a link to the university's funding mechanisms on our website. And you heard about that in yesterday morning's talk on main campus. So we do have the link for that, and that's supposed to be updated in real time. In our faculty, and I guess you wouldn't have applied for that if you only registered from January this year, but towards the end of the year, the research office sends out calls, requests for applications for really small grants, but it is to assist you and also to teach you how to write grants. So keep your eye out for that, and that's to cover research related costs. Then the library, and so one thing, if you publish your research, you do not have to pay the publication costs out of your own pocket. Your supervisor department or the faculty or the university will pay for it. If you publish in an open access journal, the publication costs up to $2,000 will be paid by the university. So just so that you're aware, open access journals, for us to publish in those, some of them can cost us up to $3,500. So publishing your work does cost money. It costs money to do the research. It costs money for you to pay to be here. It costs us money to allow you to do the research. It costs money to publish, but obviously it's all for the advancement of science and advancement of knowledge. We have details of the Office of Student Success, which is situated in our faculty, and that's to provide student support and guidance for you. And then there's also the CCDU offices, which are on main campus. So Office of Student Support is here, and they're also situated in the PVT building. So there's a few other things that we discuss. Again, copyright and plagiarism policies. Guys, whatever you do, just make sure, we're all guilty of occasionally copying and pasting things and putting it into a document. Make sure whatever you do, you go back and you edit that and put it in your own words. Do not plagiarize, because the university takes it really, really seriously. Okay. All right, so with that, I'd like to hand over to Professor Eleanor Liebhaber, and she can give you an overview of the Health Sciences Research Office.
Hello, good morning. Can you hear me?
Yes, we can.
Okay. Morning, everybody. I will just present what we do here at the Health Science Research Office. What is this this office entitled? So what is the aim of this office? To make happen that the strategic research goals of the faculty are achieved. We implement numerous programs and promote the interest of the faculty and university nationally, as well regionally and internationally. We also provide academic and research leadership, support, and overall management, direction in the development and effective implementation of policies, procedures, practices, and targets in relation to the faculty and university goals. We also provide the assistance to researchers. That includes not only students, staff, and in staff we refer also to clinicians, supervisors, examiners. So obviously for productivity, innovation, entrepreneurship, and we what is important is to promote the health and well-being of the South African population, obviously, and it will contribute to the global health issues. We also train students, staff, supervisors, etc., everybody that belongs to the Faculty of Health Sciences. So we have training courses, we teach, and consultations of all type. I will we'll discuss this in detail the next slide. We'll also offer financial assistance, incentives, how to apply for it, and all the information, and also research environment and mentorship. And always here, you can come and ask questions. We are here for support you all, and obviously to foresee and the postgraduate policy and its implementation. So to present the team, we are here, well, Prof. Maria, as we call her, the Assistant Dean, and she's in charge of the Health Science Research Office, and she collaborate, and we all collaborate very closely to the postgraduate support with the staff, obviously, with the registrar. And there is also that collaborates with us, a clinician scientist program director, that is Professor John Pettiford. And then the other area is the two areas are the teaching and training on one side and the research operation and administration. Everything is for postgraduates and also supervisors. The faculty, the Health Science Research Office is placed on the 3rd floor of the PVT or Philip Tobias building. We said that up above the postgraduate office. So in details, what we offer in training, all those courses, starting from research methodology, comprehensive systematic review courses, writing skills, how to prepare presentations in PowerPoint or prepare a poster. And also we provide courses on qualitative research methodology using the 2 different programs. And on the biostatistics, the quantitative biostats. We offer courses with different programs, basic courses. Also, we'll help with workshops and with advanced statistics as well, with different programs and sample size calculation. All those courses are run through the year and not only once, so more than once. In terms of consultations, biostatistical consultations, these are one-on-one consultations. So we offer them from postgraduates to postgraduates, postdoctoral students, staff, and it is the services are disseminated, and we are also offering in different premises. So here at the PVT building that extends to the Charlotte Hospital, at Baragwana's Hospital, at Helen Joseph Hospital, and the Raima Musa as well. The modalities, so we can have face-to-face, online, like Teams, Zoom, it could be WhatsApp, emails, everything to support you the way it's more convenient for you. We also ask for bookings. That would be much better because that's how we can assess you better. Type of consultations you have from protocol development until publications, everything, from study design, sample size, and it's also very important that we also, if you publish and you have, for example, questions from the reviewers that you don't know how to answer, and you can come and ask us. Okay, so now this moving towards the writing support, we offer also 4 times a year writing retreats for masters and PhDs, and this is the email address where you can register and also ask for information. And we have also on citing scientific writing skills consults through the year, and Dr. Anushka Ajit is the one in charge of it. And one more addition to the support that we offer are the nature class, master class that the faculty is subscribed, and you can contact your HOD or your head of school for access. And this includes online courses like scientific writing, or even advancing your scientific presentation, data analysis, interpretation of scientific results, etc. And you will have, I understand that tomorrow you will have a lecture that the group of Nature will offer it to you, and it will, I think it will be about publications and how to disseminate information, communication of research. I leave you then with Maria, Prof. Maria, sorry, it's very important.
Thank you, Elena. So I think, sorry, we didn't put the camera on for you guys to meet Prof. Levar, but we'll do that sort of towards the end. Okay, so just moving on, this is really the last few slides I just want to get through, and then we can start our Q&A. It's really important, and I'm emphasizing this because this is a new thing we've introduced, and it's effective. It's effective for any new student, well, for students who have registered for a new degree, well, either a new PhD or the MEd, MDent, for year 1 for the first time from the 1st of July last year onwards. This new rule applies to you. So whoever's in the room that has just registered now within the last few months has to do this. So we are implementing, and I'm putting structured in inverted commas because it's not to the extent that it is overseas, obviously, but There are certain compulsory courses we are expecting you as a PhD candidate or as a registrar within our circuits to do. So the 2 compulsory courses, and I'll give you a breakdown later, but for year 1 is either to do a research methodology course, and this is either done through the research office online on Ulwazi, and obviously you would there's a process to get access to that, or you can do an equivalent course that is offered through your school or department. Some of you may have done research methodology courses before you came to WITS or before you registered for this particular degree. So if you feel comfortable that you know what you need to know about research methodology, you can move ahead and do a multiple choice quiz that we have, and everybody. So we're not prescriptive about which of the courses you do, but we are prescriptive that you have to do the multiple choice quiz that is available only through us on Ulwazi, and it is compulsory. So people are expected to take the quiz and to pass it. So before anyone panics, it's really to see that you've attended the course, you have a basic understanding of what research methodology is, and as well as you're all expected to do an introduction to biostatistics. To accommodate any questions, we have an online discussion session, and this is at dedicated times. So once you start doing these things, all of this information is available. So Anushka, Dr. Jet, for example, is available every Tuesday, I think between 1 and 3, online, and she can take any questions people have around these compulsory courses. And Prof. Liebhaber is available on a Thursday between 1 and 3 online to answer any queries around the biostatistics. Outside of consultations, this is specifically just for the online courses and for passing them. And, we've only allocated a couple of hours once a week for people to have discussions and to have their queries addressed, but we will expand that if and when there is a need for it. Okay, so if you feel you're not getting, if you feel like you need more time, we please let us know and we can look into that. So as we said, these have become compulsory requirements, and we unfortunately may have to deregister students who do not comply with these requirements. So, just take it in your stride. It is not a difficult thing to do, and you will learn some valuable steps along the way that can only benefit you as you move through your research. So when you're looking at a structured PhD, so a full-time person, as we said, PhD is 3 years. It's an N+1 where N equals 2, so it's 2 + 1 full-time. And then part-time people take up to 4, we allow up to 4 years for a PhD. And I've just put here up to year 4, but this might extend into year 5 or 6. Please remember, every single year you have to come and register. Okay, so if people think they can miss a year and then come back the following year and then just register and submit, you have to get permission. You might not be granted permission. You have to pay the fees for the year you missed anyway, if you are granted permission. And it just causes further delays because you have to go through a whole process to be allowed to re-register. So please register every year before the designated time and renew your registration. Then in terms of compulsory coursework or workshops, okay, so we have the orientation, and we will have, for this orientation, we are part of the broader university one. we are going to do another orientation in October. Because we allow PhDs to register up until the end of September, we will then catch the next cohort to do an orientation after that. You then have to do research methodology and your basic applied stats using Stata and Statistica. As we said, these are offered online through the research office on the student platform or WASI, or if your department does these, you may do those. But you have to then do the faculty quiz and pass that, so that we document that as you having passed year 1 milestones. Once you've done that, there are other non-compulsory courses or workshops you can take. Eleanor put up the slide giving you the overview of that, and what you'll be getting throughout the year. So remember Shay's name, Shay Lazarus. She has a distribution list of all the postgraduate students, and she sends out notifications of upcoming workshops or upcoming courses. So if they, she sends out all the information, so you can choose to do what you like. In year 1, you are expected to have submitted your protocol for assessment, whether you're part-time or full-time. By the end of year 1, we expect that protocol to have been submitted for assessment. So you need to do the 2 compulsory courses, work on your proposal with your supervisor, and submit it for assessment with the faculty. That's the bare minimum we require of you. Then in year 2, we are going to introduce scientific writing skills and presentation skills as compulsory courses. And again, you're free to do any non-compulsory workshops. In year 3, we are still actually, as I said, this has recently been introduced for the last couple of months. So we are going to look at what are the most important courses to offer you. And we think building entrepreneurial skills and, just talking about certain things associated with your academic career advancement will be of benefit. So we'll look at those. Once you've submitted, whether it's in year 3 or year 4 or whenever, as we said, you'll do your PhD seminar after you've submitted for examination. And the sequence, the order there, you can submit and present, or you can present and then just submit and then proceed with graduation. So if you're a registrar, whether it's an MEd or an MDent, again, what you're required to do in the first, so here we're more flexible because registrars obviously are in the clinic treating patients, trying to learn at the same time and do multiple things. So the registrars have between 18 and 20, at least 18 months to do the research methodology and the basic applied stats. So it's the same online course as what the PhDs are doing, except that the assessment level or the type is just slightly different. So the sequence of events is slightly different here for the MEds and the MDents. They also have part 1 and part 2 of their college exams to complete. But very critical, if there are any registrars on this call, you have to register every year. And we are faced with situations where registrars do not actually come and register for 2 or 3 or 4 years with the university. And they are in the clinic touching patients. And actually that is illegal. They are not allowed to do that. The HPCSA number that they get only allows them to work in a clinic if they are registered with the university. So please keep that in mind and remember to come and register every year. As we said, you have to, within the first 2 years, you have to do the 2 compulsory courses and then submit your research protocol for assessment. Subsequent to that, you do the research, you submit for examination. All right. So in the booklet, So we've talked about, I guess, how great research is and research excellence. We've gone through some of the administration and focusing now, I guess, on the postgraduate student and supervisor relationship. Now, I hope and I really wish for each and every single one of you, you have great relationships with your supervisor and they become both supervisors, mentors, and lifelong friends. But you know, that doesn't necessarily work out. But what's the this is a university document. So it is in your postgrad booklet, and it's called a Statement of Principles for Postgraduate Supervision. Obviously, it's small text, so I'm not expecting you to read it, but it lists some of the expectations of the supervisor as well as the student. So a lot of the schools expect that each of the postgrad students sign this together with their supervisors, acknowledging that they've read it and that they agree to do what is here. So if you look under the supervisor, for example, the first thing says, undertake to provide guidance to the student's research project in relation to the design and scope of the project, the relevant literature and information sources, research methods and techniques, and methods of data analysis. The supervisor agrees they will give you the support for that. Okay, so, you know, take your time and read through this, but then equally take the time and read what your responsibilities are. And we want you to sign it because if there are problems, you know, you can come back and say, but supervisor, you agreed when you signed this that you would do X, Y, and Z. If they don't do that, you know, we can hold them to that. By the same token, the supervisor can come and say, you did not do this, and I told you I had this expectation, but you did not meet it. Okay, so, you know, it works both ways. And this is a living, flexible document. You know, if you feel there's special conditions you would want to add to it, you're very welcome to just handwrite, add things onto it and have it signed. And, you know, it sits in the postgraduate office, it sits in your file when you submit your proposal, you know, so keep a record of it and it's good to refer to. And the reason to do this, obviously it helps you understand what we expect from both supervisors and students, but it also helps you if things go wrong. Now, I think it's quite important, you know, like as well on campus yesterday, people were talking about making sure that your you know, students have a good experience and, you know, we look after your mental health, well-being, all of that type of stuff. But I didn't hear anyone mentioning what happens if the relationship between yourself and your supervisor breaks down or something goes wrong during your research. Okay, so I hope it doesn't happen, but if it does happen, you know, there is a particular process you have to follow if you have a grievance. There's a university grievance policy that can guide you. But essentially, the process to follow is an escalation process. So if you or your supervisor do have a problem with each other and you do not see eye to eye, for whatever reason, the best thing to do is to be bold and be strong and speak to your supervisor about it. If you feel something is not right, unfair, whatever the situation, have a conversation with them. I'll request a meeting and have a conversation with them. When you leave that meeting, I think put it in writing and email the supervisor. This is what we discussed, and these are the conclusions that we reached. Okay, see if you can resolve it at that level, but then document it, please. Okay, if the situation doesn't resolve, it then has to get escalated to the head of department. So once you've spoken to the supervisor, not resolved, you can then go directly to the HOD and say, I have a problem. Your HOD then needs to look into it and hopefully try and solve it for you. If it cannot be resolved at that level, that you then can escalate it to the head of school. And then from the head of school, it gets escalated to my office, and then I would have to deal with it. Now, you can't skip any of these steps, because if you have a problem with your supervisor and you come straight to me, I'm going to say, I have to refer it back to the department, to the supervisor, and you have to follow this process. And it's part of the university policy, and that's why I'm saying I can't deal with it. I would refer it so that it goes through the correct channels. And what you have to do is have clearly documented processes of what has happened, both from your side and the supervisor, the HOD, head of school, have to have documented that they've done, they followed the proper procedure, and then they refer it to me. And then we can look how to try and resolve things as easily as possible. And it doesn't happen often, but while I've been in this office, I have had to deal with several issues, ranging from supervisors wanting to withdraw supervision for various reasons, and then we have to deal with it to various issues. So yeah, just remember, if you're uncomfortable and things are not going the way they should be, please speak up, and speak up to the right people, and just follow a process to resolve it as quickly as possible. All right. And then I think this is the last slide, just in terms of promoting a research community, looking at how you can network and showcase your research. There's various things that are happening at the university, at the school department level, and then as well as the faculty through the Health Sciences Research Office and the Postgrad Office. So we have our website that you can go onto. And again, so some of the stuff might be a bit strange. We are busy updating it. So just be a bit patient. And some of the documents, well, we review all our documents annually. So some of the stuff might be off to get updated. We have a question and answer Q&A session with myself and all the postgraduates quarterly. So I think during COVID, we slacked off a bit, but we did have online sessions. And that's really, so Shay will send out a notice, and essentially I will be in, let's say, one of the lecture theatres, and whoever has any questions or issues can come along, and we can meet face to face and just chat about it. There's research newsletters that get circulated. We have the PhD seminars that, as I said, are going to be introduced this year, and that will be for faculty, and there'll be prizes for the best presentations. We have a faculty research day every 2 years. We have prestigious research lectures, other lectures from visiting professors, several events throughout the year that we showcase. Then we've also implemented, this has now been running for a few years, we have a postgraduate portal that people can submit their comments or their problems on. You can remain anonymous if you choose to. It does become a bit more difficult if it's a real problem to try and solve, but you can remain anonymous, and people have done that. Or you can say who you are and ask for assistance for whatever or questions, whatever that is. And that's actually worked quite well over the last few years. And as I said, Shay has got an email distribution list of all our postgraduate students. The problem with that is that it's only WITS addresses, because that's what we get off our system. And sometimes you might miss something. So I'm urging you strongly to please use your WITS email addresses. And if you don't, you need to check your WITS emails, regularly. Okay, but she'll send out any opportunities for further research, you know, locally, overseas, whatever the case is. So check that every so often. Again, schools, departments have website, their own research days, journal clubs relevant to your disciplines. You know, that you need to familiarize yourself with and embed yourself within that culture. And then the broader university, and I think they spoke about that yesterday, there's the Gold program. Later on in the year, they have a cross-faculty symposium where each of the 5 faculties, you know, the students present in parallel sessions, and then they choose winners from each faculty, and then the winners from each faculty go up against each other, and they have, you know, you have one winner across the whole university. So that's really a nice event. So on that, I think we'll end and we'll hand over to our MC and open the floor for general questions, as well as, I think, as a suggested discussion, maybe, you know, once we deal with any questions and any other queries, we can maybe have a discussion around how we can create a greater postgraduate culture and experience in our faculty. Thanks. So Paul, I'm handing over to you, and I'm not sure if Bontonde is on the line as well.
Yeah, I tried to look on the participants. I'm not sure if she is online. Okay. Okay, so this is time for questions. So if you do have a question, maybe you can raise your hand. I don't see any for now, but I'll go on to the chat. The first question was, is it possible and allowed to complete a master's by dissertation in just a year? I'm not sure if you want to take that one, Prof. Maria.
Yeah. So yes, it is possible. So keep in mind, though, the university, and it's a university rule, you cannot have done more than about 15 to 20% or so of your research before your research protocol gets approved. So you cannot use any previous work towards a particular degree. So a master's research in 1 year is doable, but it is difficult. You know, if it's an honors student, for example, that's worked on a particular project, and then they carry that over into their masters, they're familiar with the content, it will probably be easier for them to write a research protocol, and they can have it approved early on in the year. Again, if they need human ethics approval, that takes a few months. Then, you know, to actually then have all those approval, all the administrative stuff in place before you start doing a research and then writing up in a year is pretty difficult. And it's a pretty exceptional person who does that. But we have had people do that. So it is doable. We allow it.
Okay, the next question on the chart, are the master classes free of charge to students?
Yes, they are free. So just to give you a bit of background, we've paid for 100 licenses. So it is a lot of money just to get 100 licenses. So we've allocated different, you know, that's why Eleanor said contact your HOD or head of school, because we've distributed it equally across the different schools. And you know, you need to have one log-on and a password for each of the 100 licenses. So what we've recommended is that people can share the license, but that means you've got to share your details and the password for those particular licenses. We have also kept, I think, about 10 licenses in the research office, and we do have computers that the licenses are on in the research office on the 3rd floor PVT building. So if people want to come and sit here during the day to have a look at them, obviously it's allowed. And it's really, I would highly recommend it. They're really fantastic. They're really, really great. So this just reminded me, we have a postgrad hub up on the 4th floor, just opposite the canteen. And unfortunately, because of various events post the fire at Charlotte Hospital, Oral Health Sciences had to move out. So we've just allowed them to use that space. It's temporary, but again, we don't know how long it'll be before they can then move into their new space. So there is a postgraduate hub that people can sit. We have computers in there where we have specific software. There's Stata, Statistica, there's SAS, there's the qualitative software, the Invivo, Max QDA is on there. And once we're back in there, we'll put some of the nature masterclasses licenses on there. Okay. Thanks.
Okay. There was also a request if you can share the presentation slides, if that's possible. And then the next question is it possible to get a breakdown of the requirements for masters by dissertation and what courses is it possible to get a breakdown of the requirements for master's dissertation and what courses are compulsory?
Yeah, so a master's by dissertation does not have compulsory courses. The master's by dissertation is by pure research. So there's no other compulsory courses. Anybody in the faculty is very welcome to come and do any of the workshops or the courses that we offer. There's a host of them online, there's a host of them face-to-face. As we said, so if you go onto the website and as I said, Shay would be emailing out, as the other upcoming courses for people to register for them. So, there's a limited capacity, obviously, for the face-to-face meetings, and that's why we send out notifications for bookings to allow that. So that's a master's by dissertation. If you're talking about a master's by coursework and research, so the research component is like then 50% or less. So it's less than or equal to 50%. Then the coursework that you're doing, so if you're doing, for example, the master's in epidemiology and biostats, there's prescribed coursework there. You can't change that, that's compulsory to get that particular degree. So all of these are available in the postgraduate booklet that's on both the postgrad office website and the research office website. And of course, on the university website and our faculty website. If you want, hang on a sec, let me just share my screen again. So I mean, you can Google, we had the website on one of the slides, but if you Google Wits Health Sciences HSRO, it'll bring you to this page. So this is pretty cool. But if you see, there's various things you can look at. Okay. So it's about initiatives, publications. We list all the research entities, for example. So these are all the research entities, and you can go into each of the individual sites. Okay, so let's look at if you move down to the bottom of the website, you can see there's different funding entities, publications, postgrad support initiatives, pretty much the same as up here. So it's available on both. So if you look at postgrad research support, we have the information booklet, the style guide. This is the university's funding portal that I talked about. There's the link to that there. So the guys that are doing masters by coursework and research, this is important. There's a process. If you miss an exam for the coursework, you have to ask for a deferred exam. You've got to apply for it. That's here. So if you look at the, let's just go to, so if you go to the booklet, okay, sorry, let me just go to, so if you look here, the following in the book, I mean, it's the first bit of stuff. It's the following postgrad programs are offered. This is under honors. This is under PG diplomas, master's degrees by coursework and research. So it lists everything. It tells you whether it's 1 year full-time or 2 years part-time, 3 years part-time, whatever the case is. So people can look on the booklet along here. Then you have masters by research, by dissertation. It's in all the fields. PhD is pretty much in all the fields. We then offer a DSc or a MD. So medical doctors who have graduated from Wits and who have published a body of work can retrospectively put that work together and be awarded a Doctor of Medicine, which is viewed as an equivalent of a PhD, but it was not done under the traditional PhD where you have a supervisor who guides the research. But we do make an allowance for that. And then the DSc is actually a very experienced, shall we say, older researcher who has a significant body of work, and they put it together. And that's really the highest degree you can get anywhere in the world. So it's really an acknowledgement of your lifetime of work. And in fact, last year, our faculty had three people that graduated with the DSc. And one of the individuals is Professor Frederick Roll, who is an A-rated scientist, you know, just to put that in context. So, yeah. So then the booklet, yeah, there's the flow diagrams for admissions and registration. So I think it's pretty comprehensive, you know, if you look through it, what you have to do. So I'll stop sharing that. Yeah, so you guys can take some time and look through this. As I said, this links through to the postgrad office, and then here's all the forms you know you need to have, and there should be more forms coming on here, but the rest of the forms are available either through, well, in the booklet, etc. Okay, so let me stop sharing. I have too many I had too many things open there. All right, further questions?
Okay, I think some of the questions are well covered in that booklet, but there's a question about whether there is a preferred referencing style across the faculty. I mean, within the faculty, or does it referencing style vary depending on the school?
Yeah. So it is, we do outline it in the style guide. So, you know, it's sometimes different disciplines ask for different referencing styles. And, you know, depending on the journal, you might have a different referencing style. So whether it's the Vancouver or Harvard, there might be other styles. So if you're submitting by publication, you know, if you have 3 or 4 publications, they're all going to be different styles because the instructions to authors from the journals. The key is that if you choose a particular referencing style, you have to be consistent throughout your entire research report, dissertation, or thesis for any of the stuff that you are writing outside of something that's in a publication. So we're not prescriptive. as long as it's consistent. Thanks.
Okay, I'm not sure if there's anyone who would like to unmute and ask a question.
So sorry. So the one thing I did want to add on the question thing there, I guess then maybe Paul, we can get off and you can maybe have a discussion with the group when we're off, and maybe just give me some feedback. Did people find the presentation we put together useful? Or, you know, did it meet their expectations of what they would like during an orientation? Or, you know, or do they want more details, or what should we be focusing on for the the October orientation? Hopefully that one can be that one will be a hybrid event. So people that are here can meet face to face, and then there can be online people as well. But we would like some feedback on what to include, exclude, whatever. Thanks.
There's a hand from Monde. Monde, go ahead.
Good morning, everyone. I just wanted to know if a person, there's a program that I've seen in other universities called to become a physician scientist, along those lines. Basically, it allows a person to do both medicine and some postgraduate programs, in the sense that a person could be doing either medicine third year and then on, for example, UCT, you're allowed to do third year medicine and honors, and as you go like fourth year masters and so on. I wanted to know if maybe VITS has that option. Perhaps if a person can combine an undergraduate degree and do an honors or masters and a PhD in the same academic year. I don't know if I'm making sense.
Thanks. So there is a program. It's and the faculty used to have it many years ago, and it kind of like, I think, lost popularity perhaps, or not. But we have revived the program, and it's an intercalated. We're calling it and it's an intercalated PhD program. And I'm talking about PhDs in particular. What we can allow is for medical students to take time out. So you would have to take time out. We're not actually allowing you to do it in parallel. You can take time out to do an honors if you want, or you can take time out to do a master's degree, or in the intercalated PhD program, when you get to GEMP 4, or a bit later, we can allow you to take 2 years time out, register for your PhD, you know, do the proposal, you know, do all your data collection during that time frame, and then come back, finish up your medical degree, and then you know, go and start your internship. Once you've graduated with your medical degree, you are then qualified in terms of national law to graduate with a PhD. So you can then complete your PhD and graduate. And in fact, you could graduate concurrently with your medical degree and a PhD if you're that motivated and that you know. So that is a possibility, and that's what we've introduced this year. And in fact, we have our first cohort of intercalated PhD candidates that started and registered on, you know, in January this year. So it is the program. Obviously, there's conditions around that. Yeah, and it is around funding as well. So there is some funding from different agencies that is available for us to access. So I hope that answers your question. But you cannot, so we only allow that for medical students. The university rules, and this is nationwide, it's actually a DHET rule, you know, people cannot be registered for 2 degrees at the same time. and you cannot be registered at different universities for different or the same degrees at the same time either. That's actually illegal. It's not allowed. So it's just one of those things, except in this in the instance of intercalated medical degrees. Thanks. Hope that answers your question, Mondi.
Yes, it does answer my question. Do you guys know who we can reach out to and contact if they more information?
Sorry, I couldn't hear what you said there.
I was saying, can you hear me now?
Yeah, that's much better.
Yes, I was saying if maybe you can, where do we get the full information with regards to this, and who do we reach out to?
All right, are you a medical student?
No, but I do plan on camping.
Okay, but you know what, when you get there will be, so that's part of us upgrading the postgrad booklet for this year. So that information will be available online from 2023 onwards, because it's a new program and we're putting it in the booklet. You'll be able to find it when you get there.
Okay, thank you.
Cool. All right, I see I can't actually see the chat. So Paul, if you can just look at that.
Okay, let's see. Okay, so there was a question about specific dates for submission for examination.
Yeah, so just in terms of the submission dates, the academic year, so you guys, will register as soon as the postgrad office is open. It opens, I think, well, this year it opened on the 3rd of January. Once.
Yeah, are you still there, Prof. Maria?
Of February. So anybody who completes.
Prof. Maria?
Yeah.
Yeah, we lost you there for some few seconds.
Oh, sorry. Okay. So the academic year, I didn't have the 2022 postgraduate numbers because the academic year runs up until the end of February. So anybody who completes their degree until the end of this month is actually counted in the 2022 statistics. See, so submission of research can happen up until the end of February of every year. Once you submit for research, you have to remain as a registered student, but you are registered as an awaiting examiner student, and you pay a copyright fee of 120 Rand. By approval, we could allow you to submit up until the end of March, by motivation, sorry. So you and your supervisor would have to motivate, but, and we could allow you to submit for examination at the end of March. But then on the 1st of April, so guys, please don't come and ask me, but on the 1st of April, the university systems charge full fees. You have to then register. So even if you submit on the 3rd of January for examination, you have to pay fees. Okay, so you have to meet that deadline if you don't want to pay the subsequent year's fees. And it's a university inbuilt IT thing. I'm not a miracle worker. I can't change that. So please don't ask me to waive your fees when you get to that point.
Okay, I think there was another question about how do we access Ulwazi and how soon can one begin with the courses?
So Ulwazi, you guys can email Anushka, or it's courses. There's a specific email. So Anushka, if you want to just put that in the chat for everybody. So you just send an email and say you want to register for the compulsory research methodology and biostats, and you'll be sent the link. and then you have to register to do the quiz. It's online. The questions change automatically, system generated. So they change, and you have a set amount of time to do the quiz in. So I see in the case where somebody completes their master's by dissertation in, let's say, 1 year and 3 months, okay, if they have moved into the second academic year and they've missed the deadline, as we said, they will be charged full year's fees. It's not divided by the 3 additional months that they've registered for. You have to pay full fees. Okay.
Yes, that was the question that I was looking at. I don't think we have any.
Yeah, but there was, sorry, I got onto the chat, but there was a question just above that. So just to emphasize that.
Okay.
Preferred referencing style. Okay, so Anushka's put on some resources, I see. Yeah, and as she's highlighted, and we've highlighted it, that we should be putting the 2023 booklet up soon. All right, so does the faculty allocate the supervisor for research and for coursework? When do we have to start working on that? So the masters by research and by coursework and research, yes, the department generally allocates supervisors to the students. Ideally, they count on supervisors submitting projects. So if they have 10 students, it's great if they can submit 20 or 30 projects. So that means each of the students can pick a project, and chances are they can work on something they're interested in. If unfortunately they have 10 students and only 10 projects, then, you know, each department would work out how to allocate. Okay. By contrast, if you're doing a master's by dissertation and a PhD, you cannot register until you have a supervisor who's committed to supervising you. And the faculty will not allow you to register as a postgraduate candidate if they don't have a letter from a supervisor saying they have agreed to supervise you for this degree. And the expectation is that the supervisor and the head of department or the head of school sign that. And they have to say, so sorry, you see, we rushed through things and I did forget to talk about certain things. So the supervisors have to say they have the funding to cover your research costs, as well as the infrastructure that you need to complete your research. And unfortunately, we have had instances where people come and that's your homework as postgraduate students. Okay, you have to make sure that your supervisor has enough money to do research and they have all the necessary equipment or the infrastructure or whatever. So I cannot take on a postgraduate student unless I have already got grant funding before the student comes. So in my case, the PhD students that I would take on have to work on dedicated projects that I have funding on. So, you know, it's already a predetermined kind of project with specific objectives that have to be met because I have to meet the funder's requirements. So for example, you know, and one next generation sequencing run costs over 100,000. You can do a maximum of 96 samples on it. So I have the instrument in my lab. If I don't have the money to buy the reagents, okay, you can't do the project. So you can't say, yeah, the instruments are there and we'll find the funding. Okay, as postgraduate students, so this is important to talk about. You are not required to find your own money to do the research, okay? You must make sure that your supervisor has enough money to buy all the stuff that you need. Now, I'm not talking about photocopying costs, you know, let's not get ridiculous. But there's certain things as a postgrad student, you know, you must buy your own pens and things like that. But, you know, anything you need, if it's like a clinical thing, a diagnostic test to be done, you know, if it's laboratory based, if you need specific software, that's the key component of your project, your supervisor and or the department have to have it. You should not be coming on and signing on to do a project where the expectation is that they'll find the money after you join, okay? Because you're going to be here for 10 years while somebody finds funding. And then I'm going to have to exclude you and tell you we have to deregister you because you've gone over time, okay? So please, and if supervisors tell you otherwise, please come and that you come straight to me and have a conversation with me about that, because that's actually inappropriate. By the same token, you should not be paying for publication costs out of your own pockets. Okay. So just please keep that in mind. Yeah. Thanks.
Okay, I'm not sure if there are any other questions. Is there anyone who wants to unmute and just fire a question? Still have some few minutes.
Maybe Paul, I'm not sure if you have a list of who's attending. Would be good just to get an overview of the candidates that are on here. So can we maybe see a show of hands of who's a PhD? So I'm assuming everyone here is a registered student. It's people that have already registered since the beginning of this year. That was my understanding. So can we see a show of hands of how many people are PhDs? Okay, that's a lot. Okay, 1, 2, 3, 4, 5. Okay, that's 8 PhDs that I can see. That's great. Masters by dissertation. Okay, wait, I think I see 2 people. Okay, masters.
Hello, sorry, Aloni guys.
Sorry?
Aloni guys for masters.
Okay, so there's 3 of you then. All right, and then are there any registrars or dental MEDs or MDents? I wasn't expecting any. I didn't see any. You see, so me spending 20 minutes talking about registrars is then useless for you guys. Sorry for subjecting you to that then. And then honor students. So I'm assuming then the rest of you would probably be honor students. And okay, one, yeah. All right.
I am master's by coursework.
Yeah, I was going to come back to that. So okay. And then the rest. Okay, so basically it's people that are based. Yeah, so there's no registrars. Okay, thanks. So it would have been good if we'd asked this at the beginning of the presentation, because then I wouldn't have gone into details around the rest of the stuff. Great. Okay, so it's good to know. So I hope you found it useful. Yeah, you had, was it we had their hand up? I think it's gone down now. Okay. Any further questions, guys?
Just a question. Masters by coursework. I just wanna understand that then the timetables for when the contact classes will begin is going to be sent out, right?
Yeah.
Okay.
And that's the different schools / departments. The research coordinators are responsible for all of that. So some schools have departments and divisions, others don't. So like physiology doesn't, public health doesn't really have. They are, but it's not formal Yeah, sorry. Okay, I see there's some hands. Paul, shall I take this or do you want to take this?
No, you can continue, Prof.
Okay, so I think I see, is it Misibudi, first hand up?
Yes. Hi, Prof. So I wanted to, I'm not sure if I missed the answer to where can we access the dates where we're supposed to submit our dissertations by, for examination by.
So you can submit for examination throughout the year. But if you want to not pay an additional year's fees, you have to submit within that particular academic year. And the academic year ends at the end of February of the following year. So the 2022 academic year ends at the end of this month. And on the 1st of, so, and if you haven't submitted by the 1st of April for examination, there's a month that you can ask for special permission to submit. And then if people haven't submitted, automatically the system charges you a full year's fees on the 1st of April. Okay, but you can submit anytime. There isn't like, you know, you can only submit between the 1st and the 28th of February. All right, the next. So I hope that answers your question. The next is Quinn, but I'm not sure if that's your name. Go ahead.
Yeah, that's correct. I just wanted to ask again for the copy of the slides of the most recent presentation.
Sure. I don't see what value that is because basically all the stuff is on our website, and some of the information is we update that. So I prefer not to really.
Okay, that's
actually,
all right.
I prefer you guys access the websites. Everything you need is there. Okay, thanks. And then the next person is in Ndlovu.
Thank you very much, Prof. I have an issue that I have communicated and I'm trying every day to resolve it. Hence, I haven't registered. I raised my hand though under the PhDs because I'm doing my PhD, accepted at the School of Public Health. However, I'm unable to register on the system. I sent a very big email explaining some items to the school faculty, the faculty registrar, Ms. Ben. And I'm also back at the school liaising with other people to assist me to resolve this issue, but it's just not getting anywhere. I'm not getting responses lately. So I'm just really pleading to get assisted so that my registration can be concluded. Thank you.
Yeah, so the problem is you want, okay, I'm not going to get into it. I'm aware of this, but,
yeah.
and you have been liaising with Mrs. Ben, so it's not like we've ignored this. So I think there's some miscommunication happening around that.
Yeah.
And I mean, you've already registered for your PhD. You've been here for a few years already. So it makes it a bit difficult to, yeah. So we won't raise this on this platform because obviously everybody's listening. Yeah, okay. I can send you a comprehensive email after this, but I see, because I have been CC'd on some of the stuff, so I am aware of it. So guys, just to point out, so again, obviously we're available and you can email myself, Sandra. I mean, if there's an escalation process, you have to follow that process, but you know, you guys send us emails. Now remember, Sandra is overseeing like 7,000 postgraduate students. You know, she has a big office to manage with a lot of staff members. We have meetings, we have other commitments. You know, I'm running research, postgraduate. I do my own research as well. You know, we get hundreds and hundreds of emails every day, and we we get to everything, but it doesn't happen in the first hour that you email us. It's not going to happen in the first couple of days even necessarily. So, you know, you have to understand that, and especially at the beginning of the year, we have thousands, and I'm saying thousands of emails from students and queries, and then the supervisors are querying and all sorts of things. So it is chaotic. And everything has to go through, ultimately through myself and Sandra. So, you know, you have to be patient. And sometimes your queries are not going to get solved instantaneously. So you just have to understand the context that we're coming from as well.
Thank you, Prof. That's noted.
Thanks. And just to emphasize, everybody is required to register every single year. If you do not register, okay, there are consequences to that. You know, and if you know, so please read that booklet. Okay, you have to understand the rules and regulations around being a postgraduate student in this faculty and in the university. As I said, ultimately we comply with the rules that govern this university. So please do that. Please acquaint yourselves with it. It's part of your professional development. Wherever you end up as researchers, you know, it's something, it's the boring stuff, but you have to do it. Thanks.
Okay, I don't see any other hands. I think anything from maybe your final words, Prof, before we conclude.
Yeah, thanks. So Paul, thank you very much for coordinating this. Again, just to apologize, we started late, but I think we're finishing just on time. I would appreciate if people, you know, feel strongly about whatever we've presented, either way, if they can maybe send you comments, you can pass them on anonymously if you choose to, just so that, you know, it's just so that we can improve for subsequent cohorts. And it is, as I said, difficult doing online. It would be great to run you, you know, and 3 hours is quite limited. It will be great to run you through a whole bunch more processes in a lot more detail, and with breaks and refreshments in between, because some of the stuff is interesting, some of it's boring, but we have to say it, you know, some of it can spark good conversation, so it can be a lot more interactive. So please send your comments to Paul if you can collate it, Paul. Thanks. And I really wish you all well in your endeavors here. And I really, really hope that you have a good postgraduate experience. As we said, please send us your comments and make use of all the resources that we've provided for you. These resources have been built up over time. This research office has been in existence for about 15 years or so now. And, you know, there has definitely been a positive impact by having these resources available on our campus here, dedicated to health sciences. So take advantage of everything that's offered to you. And I wish you every success. And welcome to our faculty. Thank you.
Thank you, Prof. And thank you everyone for joining us. That brings to the end of our meeting. Bye-bye.
Thank you.
Thank you so much. It was really helpful. Thank you.
Thank you, team. Bye.